Angela, thank you so much for joining me today.
Thanks for having me.
Excellent. As you know, we've been exploring ways of enhancing our HR policies at LEAD, our practices, HR practices as well. And particularly, I wanted to understand, I've often heard you say the importance of HR health check. What is an HR health check?
Great question. Well, fundamentally, it's a way to stop and take stock of where your organisation is at in terms of all the key compliance areas when it comes to having staff in your business. So looking at what policies and procedures you have, what's your process for performance appraisal, recruitment, all the regular things that will come about, what do you do when there's change, and so on. So it really takes a look at everything and highlights for you areas that you could improve.
That's great. So from a community sector perspective, as you know, mainly small to medium-sized not-for-profits, what would be the benefits of doing the HR health check?
Well, the way that we offer the HR health check is a big time saver, and I know that CEOs, EOs, general managers, all the people that work in small to medium not-for-profits are time poor. So we make it easier, as easy as we can, and taking you through that will not only take the load off you to answer those questions yourself, we'll support you through that process by facilitating it with you, giving you guidance and on-the-spot advice, but you'll walk away with a plan that you can then actually prioritise plan that you can then actually put into place when you have the time to do that. So it puts you on the right spot for where to go to from there.
So say, from LEAD's perspective, as a small organisation, do I have to take some initial steps to prepare for the HR health check?
Well, if we were about to do it now, Shamili, all I would ask of you, which you probably already know off the top of your head, all I would ask of you is to bring some information to our chat, the HR health check, where, I'd be asking you things like, do you have policies in place? Do you give an employment contract or a letter of offer to your staff? And things like that. So I would just need to know from you the basic documents and processes you have in place. I don't need the detail at that point, but just do you have them and who's aware of them?
So you're actually going to walk us through that process. I don't have to come prepared with things. Fantastic. Oops, good to know. In terms of compliance, what are some of the common compliance issues that you may have uncovered whilst doing an HR health check?
It's funny you say compliance. It seems to be one of the things we're talking about a lot at the moment at ASTER HR. There's been a lot of legislation change of late, and the leaders and managers and business owners that we're speaking to are wanting to be on top of that. So the major things that we're working through at the moment is understanding those legislative changes and how does it impact your business or your organisation. Is it just a policy change or is it actually a full process change, thinking about things differently, and that sort of thing. So that's usually front of mind for people, and they enjoy us being able to unpack that in a really practical way.
How frequently do you think an organisation, a small to medium-sized organisation, needs to do an HR health check?
Sure. So, the initial check that we do with you is extremely thorough. It goes through all areas of the organisation. And as I said, you get that plan to take away and implement. Now, some of those things you may not need to implement right away. You might choose to do it when you have an additional funding or more staff or time to put into initiatives that you might not have thought of. And that's okay. And so those sorts of things, we wouldn't expect that you would have to check yourself on those things over and over in a really frequent way. But I would say, at the very least, always check in about your policies and procedures in perhaps about an annual basis, especially when legislation is changing as much as it is at the moment.
Absolutely. You mentioned about staff, and I think you would know that too, Angela. Given in the community sector, there are changes in the workforce happening at the moment, and staff engagement and retention is a key issue and consideration for many execs at the moment. How does a HR health check help build staff engagement, satisfaction, retention. Can
Great
you share your
questions. Well, I'm thinking about the areas that we would touch on in the check that definitely talk to employee engagement. We would go into areas like, do you survey your staff and get their feedback? How do you understand their performance, and how do people know what's expected of them? And communication. Is there initiatives about well-being, or things like that in place? So we would touch through all of that in the HR health check. And if you are feeling a little bit unsure about that, if I said well-being and you go, I'm not really sure what that is, we would just tell you then and there. We give you advice on the spot during that to say, it's okay, it's something that you could think about if you haven't already got something in place, and make that as practical as it is for your business specifically. And so those initiatives, if you're thinking about that and considering it, even if it's something that you put in down the track, are all ways to not just temperature check how much your employees are engaged, but there are ways that you can improve that as well.
Yeah, I mean, when you talked about well-being, that's something I can very confidently say we do that well at Lead. We champion that for the sector. So yes, of course, and that's so important to ensure that meeting contractual obligations, everything else, but at the core of it is looking after the well-being of the team members who are delivering these programs and services.
Especially with staff that you have, because I know the people in the community sector are so passionate about what they do. And thank goodness they are, because they do such an important job.
Thank you.
But that work, no doubt, has a taxing effect after the long term, So they do need to be looked after. And the people I speak to are often so passionate about it that they put that before themselves at times. And so they need that support to back them up to keep going, I believe.
Absolutely, well said. And of course, you having so many years of experience in the community sector, leading and helping the leadership team in organizations doing the HR health check. And as you said, we don't have to be really prepared with it. You're going to walk us through the process. It's going to be really helpful. Does it also help in aligning the strategic direction of the organization with the broader objectives and the operational plan? Does that help give clarity towards that process?
That's a great question too. When I think about human resources, if you do it effectively, or just looking after your staff, we'll call it that, if you're doing that effectively, it will feed nicely into your strategic goals and actually help. One and the same will help each other. So when I think about the HR health check, there are parts where we check in with you, are you talking to staff about your values and your vision, even as far forward as the recruitment process? Do you stop and talk about your strategic vision or goals for the year every year with people? Are they encouraged to participate in that process? And then, of course, bringing that into performance management or performance appraisal with staff as well, so that you can then, again, check that on a regular basis with people so it's not forgotten. So, I think it definitely does assist with keeping on top of what those goals are and bringing it into not just your HR practices, but conversations with staff at even a daily level or a regular level at least,
Thank you so much for your time,
You're
Angela.
welcome.
And it's a great opportunity for our lead members because through ASTER HR, Angela has kindly extended the offer as a part of our partnership for a free comprehensive HR health check till the end of July if you decide to renew or join lead membership.